Hey guys, Dr. Heimlich here, and today we're going to be talking about celiac disease being a precursor for thyroid disease and fibromyalgia. Now, back in 2003, the Celiac Disease Control Center in Chicago put out some pretty startling numbers, and they said that, it affects 1% of all Americans, celiac disease. And 90% of those people go undiagnosed, and they have chronic pain, bowel issues, fibromyalgia, and thyroid issues, according to them. There's 200 signs and symptoms having with celiac disease. You know, most people think of celiac disease as, oh, I eat a piece of bread and my stomach blows up and all of a sudden I get really pain and it hurts and all heck breaks loose. Well, that can certainly happen. But, you know, here's a lot of other ones. Recurrent abdominal pains, gas, bloating, chronic diarrhea, vomiting, fatigue, weight loss, anemia, skin rash, stunted growth in children, osteopenia, osteoporosis, infertility, sores in the mouth, peripheral neuropathy, anxiety, depression, joint pain, fluid retention, bruising easily. That's a lot of stuff. And that's just scratching the surface of the 200 different symptoms that you can have with that. Now, I know a lot of people are out there saying, well, you know what, I thought maybe I had that, and I went in, my doctor did a blood test, or my doctor went in and did a colonoscopy and said that I don't have it. Well, you know what, that's not necessarily the best way to test for it. There's better ways to test. One of the best ways to do it is a gene test. You take a little swab, you stick it in your mouth, you send it off to the lab, and they will let you know if you have celiac disease or not. You know, there's a lot of advancing. It's kind of like CSI stuff because it checks with your DNA to see if you have one of the two genes. It'll let you know for sure. It also, that same test will test to see if you have gluten sensitivities. And that's real popular now. A lot of people are having gluten-free stuff, and by well rights, a lot of us do have sensitivities to it. Gluten's found in wheat. Sometimes the research is showing too that you may not even have a problem with the wheat. Then all of a sudden they deamortize it, and they process it, and now you have a problem with it. So it's kind of crazy what we're doing to our food sources, but I won't even get onto that. That's a different blog post entirely. So the thing to know is that most of the blood tests out there and stuff like that they do isn't very specific to see if you have a celiac disease or a gluten sensitivity. So in today's world, unfortunately, you've got to take charge of your health for yourself, and you have to kind of educate your doctor on these type of things. So if you think you've got that going on out there, you know, maybe celiac disease or gluten sensitivity, for crying out loud, don't think that just because you had a colonoscopy and or biopsy and it came up negative that you don't have that. There's a lot of different flavors, if you will, of gluten sensitivity and also having celiac disease. There's really some great things out there to be able to do it. They actually have newer labs out there with blood tests that are very specific, have one standard deviation as opposed to some of the other tests have, you know, about 3 to 5 standard deviations, which is a bunch of mumbo jumbo, I realize, but basically what it means is they're very specific. So if they say you've got it, you've got it. If they say you don't, well, chances are then you don't. So the thing to remember is that if you have celiac disease, it's going to be a precursor to things like thyroid dysfunction, Hashimoto's, as well as fibromyalgia. Because a lot of times fibromyalgia people will have a big thyroid problem going on as well as a lot of other things like we've talked about too. Could have some anemias, could have some blood sugar issues, not necessarily diabetes, parasites, bacterial overgrowth, a lot of different things in there. So if you think you have maybe some type of thing with celiac disease, talk to a doctor who knows about the DNA testing and the other tests as well. Get those tests done. I'm Dr. Heimlich. Hope this has been helpful.